Okay, so hi everyone. My name is Aliana Fine. I am a third-year medical student at Stony Brook School of Medicine, located on Long Island in New York. And I helped put together this webinar, and I'm going to be moderating it. And everyone else on this webinar, they are our panelists who we thank their time and energy and help into making this a success. And I'm going to start by asking all of the panelists a few basic questions. So the first question I'm going to ask is if you can please introduce yourself with your name, where you are in your training, where you did residency, where you did or are currently doing fellowship, what your current job title is if you are an attending physician, and one sentence about why you chose to go into the field of REI. And the first physician who is going to answer this question is Dr. Chen.
Okay, so I'm also the oldest person here. So I currently am the director of the Division of Reproductive Medicine at the St. Barnabas Medical Center in Livingston, New Jersey, and the head of the Institute for Reproductive Medicine and Science, IRMS. And we have offices all over New Jersey. Let's see, I went to college at Brown, and then I grew up in Philly and went to medical school at Duke, and then went to Hopkins for residency and fellowship, and was on Long Island for a little bit, and then, but now I'm a Jersey girl. I've been in New Jersey for the longest out of any of the places. What else was I supposed to answer? Was that it?
One sentence why you chose REI.
Okay, when I started REI, I chose OBGYN because it was a happy field and I got to deliver a baby in medical school, and that was the nicest department. The nicest people in the department were at Duke were the OBGYN residents. So, and they really inspired me. Then I got to Hopkins and I liked everything, but they were just starting their IVF program. Okay, this was way back in the 80s before there was CDC reporting, anything like that. People were making test tube babies. The pregnancy rates were very low. We were doing IVF in a broom closet. And I just thought, like, oh my God, this is the future. This is incredible. There's so much to learn. And just, can you imagine making little test tube babies in a broom closet? So I just thought, that's for me.
Oh, thank you. And now we're going to open up the floor to Dr. Foreman.
Hi, I'm Eric Foreman. I'm currently the Medical and Laboratory Director at Columbia University Fertility Center. I did my medical school at SUNY Downstate, residency at Duke University, but after Serena was there, I guess I was one of those nice OBGYN residents. And then I did my fellowship at a combined program, Reproductive Medicine Associates of New Jersey, and at that time, it was Robert Wood Johnson. Now it's Thomas Jefferson University. I was interested in REI, like when I really sort of learned about what IVF was and started thinking about what my career path would be. And I stayed interested throughout medical school. Actually, during medical school at SUNY Downstate, there wasn't an IVF program, so I sought out mentors. I know there's questions on that. And I shadowed someone in Manhattan. I shadowed someone out near where Eliana is right now in Long Island. And I spent the weekend like doing egg retrievals and being in the lab, and I just thought it was such an amazing field. And I have no regrets going into this field. I think there's a lot of opportunity for the future.
Thank you. And now Dr. Omer
Tag. So I decided at a young age that I wanted to do this. I did a camp. I did the Duke TIP program when I was 15, and I was like, oh, I took a genetics course. It was a nerd camp, and I was like, I got to do this reproductive endocrinology thing. This is like 1996. They were cloning sheep, and I was like, oh, this is going to be the frontier of science. What's the medical field that is closest to this? Oh, it's REI, reproductive endocrine infertility. Sounds good. My uncle was an OBGYN at Barnabas and in Livingston. He lived in East Brunswick. And he was like, you're crazy, don't go into OBGYN. And I was like, no, I'm going to do it.
Wait,
I had the opportunity.
Uncle was at Barnabas?
Yeah, Callis, C-A-L-I-S.
Oh my God, okay, cool.
So So I had the opportunity. I'm from Missouri. There's a 6-year medical program in Kansas City. Shout out to Dr. Caton, who also is an alumni of that program. It's a 6-year program. You go right out of high school. And I said, I'm going to be a physician. I want to be a physician. So I want to be in healthcare. This is what I want to do. But then, so let me just go through this route. So I did that. And then I went to Emory for OBGYN residency. Shout out to Dr. Libby at Atlanta. Great town. And then I came back home to WashU, where I did fellowship, and now I'm faculty, where I'm the associate fellowship program director at Washington University School of Medicine and an associate professor. This field, there's never a dull moment. I wanted to do something where I would always have a fun time talking about my job. There would never be a dull moment. And that's why this field makes sense. So we'll talk more about it.
Great, thank you. And now Dr. Trevax.
I muted myself. I had a visitor. So I am from Michigan originally. I went to the University of Michigan for undergrad, and then I lived in New York City for a little bit, went back for medical school in Detroit at Wayne State University, and then I did my residency at Winthrop University Hospital on Long Island, went across the country to UCLA for fellowship, and we decided to move back. My wife's family is here on Long Island, and never left again. And I work at Stony Brook at Island Fertility. And for me, I really, like all of us, I think there's some attraction to the field of OBGYN. I loved obstetrics. And in my residency, I didn't decide till my second year to apply for fellowship. And I met someone, and he was like, you know, most of the time babies will fall out, and they've been falling out for years. You can help people in a different way. And the more that I sort of followed this doctor around and mentored me, I really sort of fell in love with the ability to help people who really want to build their families and help them in a way that they really hit a point where this is all they want in their world, and we're really able to participate in that. And, you know, I think that we're really fortunate, and I think we all feel very lucky to be in this field. And, you know, for people who are interested in it, we feel very good about what we do, and we're willing to and want to talk and sort of almost tell them and help them and sell what we do, because it really is a very cool field.
Thank you. And now Dr. Anderson.
Hi, so my name is Kelsey Anderson. I did residency in OBGYN at Washington University in St. Louis, and then was lucky enough to stay on for fellowship. Shout out to Dr. Omertag, my boss. So I really fell in love with OBGYN with, like Dr. Chandra, just I wanted to deliver a baby. I enjoyed it. And then I did shadowing as a medical student in REI in particular. I saw a transverse septum repair, which was the craziest thing I had seen at the time, crazier than delivering babies, because I'd seen that so many times by then. So it was just such a cool thing that I'm like, okay, this is it. This is what I want to do. So I just trying to dive deep into research and doing shadowing. I just love REI. It's a progressive field, it's a creative field, it's an innovative field, which is unlike any other that you'll see. And that's what I love so much about it. I mean, I'm a first-year fellow, fresh into my second week on, so it's been an amazing experience so far. So I'm excited to do more.
Awesome. And now Dr. Kason Vout.
Good morning. I'm so happy to be here with everybody. So I've always had a love for OBGYN. I told my parents when I was 5 I was going to deliver babies for a living. They didn't really believe me, but I was very much determined to do so. And I always had that interest in women's health. And when I was a teenager, I found out that my aunt had to undergo IVF and infertility treatments in order to have her son. And so that kind of sparked my interest, having a close family member that was affected. And I just kind of took off from there. I went to University of Missouri, Kansas City for medical school with Dr. Omertag. And then I ended up going to the University of Maryland for my OB residency. And they actually didn't have a REI program there. So I didn't have a lot of exposure to REI within my program, but I always just maintained an interest and I try to stay active and just learn about it. And then I ended up doing 2 years of research at Hopkins, and then I joined in and I actually started the first combined REI genetics program at Johns Hopkins. And I'm currently in my 4th and final year, because instead of 3 years, it's 4 years.
Great, thank you. And now, Dr. Harrington.
So, hi everybody, my name is Eduardo Harrington. I'm originally from Venezuela, slowly made my way north. I did my med school and my residency at Harvard, at Mass General and Brigham, and now I'm at UCSF doing my fellowship. I'm a 2nd year here. I originally went into OBGYN because I thought that pregnancy was one of those times where like you could really make an impact in people's lives. Like people were dedicated to changing their habits, losing weight, giving up drugs, and I felt like I really wanted to work with engaged patients. And then once I got to OBGYN, I realized that there's no one as engaged as fertility patients in building their families. It's also a field, like a lot of people have mentioned, that incorporates a lot of really cool technology and interesting advances in science. So you can be helping people change their lives and at the same time playing with really cool toys. So overall, it's been a great experience so far, and I'm looking forward to a couple of decades and the next hour with all of you.
Great, thank you. And now Dr. Libby.
Hey everybody, I'm Valerie Libby. Nice to meet y'all. So let's see. Basically, I'm from Atlanta, Georgia, and I like wanted to be a million things, like a fashion designer, psychologist, all these things. I had no idea. Anyways, I went to college at University of Texas and studied psychology and Spanish, realized I wanted to travel the world and save people, and I come from a family of doctors. And so I went and did a master's in global public health at George Washington University. And I lived in Kenya for 6 months. I did like awesome projects. But while I was there, I was like, you know, you learn a lot about public health. So you learn about helping populations of people versus helping individuals. And I realized that although I love public health and helping populations, you don't get much satisfaction, as we're all seeing with COVID, because really people don't thank you for preventing something from happening. And I really love the personal interactions from my love for psychology that you have within like medicine. So I decided to go to medical school, and I knew that I was smart enough to do it, and why not just, you know, utilize that brain to like, you know, help people in that way on the ground. So I went to medical school at University of Texas in San Antonio. I initially thought I would do pediatrics because I love kids. And I thought I'd do like a global health spin with that or something. But then I was like, in medical school, I'm sure in most medical schools, you get to spend a summer choosing, you know, what research you want to do. And so I went to Atlanta. I had a research thing set up at the CDC working for vaccine research. I thought it was going to be so cool. But my personal OBGYN in Atlanta was like, you need to learn about this field, REI. And I was like, I don't even know what that is. I had no idea. I had never heard of it. I'm 34. So like back then, no one was talking about it. And the second I walked into the office, I was like, and I turned down my CDC thing. And I was like, this seems interesting. All I know is you help people make babies. And I walked into that office and I realized that there was a tiny little window that the surgeons were like passing off this lady's eggs to the embryologist and creating babies. And then I sat in on a patient consult and realized these couples that were having trouble, or individuals are having trouble making babies, that we could help them. And I was like, oh my gosh, this field is amazing, and the psychology behind it is so cool. So then I did research starting in medical school. Now, I'm not the best test taker, so I knew I had to utilize my strengths, which is like networking and stuff like that. So I didn't kill my test. I didn't ace my test. You know, I did well, obviously enough, but I was all, for me, you can still do it if you have a good personality, but you don't have the test scores. Like you just have to, you know, work really, really hard and like use your brain, like, work really hard and use your networking skills, whatever your skills are. So I actually went to residency my first year. I got into my third choice in New York, North Shore, LIJ, which is a great, amazing program. But at the time it didn't have REI. And I was like, I knew I wanted to do REI, but they have a good REI program there. I'm just going to go and like do research. So I poured myself into the REI clinic there. I was there literally as an intern. Like the second I got off of work at 6:30, I went straight to the clinic, sat there with the people that cleaned the clinic and just did research, because I knew coming from a program that didn't have REI, I'd have to work extra hard. After 5 months, my friend in Texas was like, you should transfer to UT Southwestern. We have an REI program, and someone just dropped out. And I did. I transferred. I ended up transferring. It was crazy. But listen, it happens. And it's okay. And you can do that. If you're not happy in intern year, no one's happy, by the way, you move. And then I ended up continuing to build up my resume. I probably would have gotten in coming from North Shore, because my friend that was 2 years above me, who, also, she got, and, so you don't have to go to a place that doesn't have REI, which someone asked in their Q&A, but it definitely helps. And I can see from experience both sides. It just makes your life a little easier. You don't have to stay at the clinic until midnight every single night. That's how I got into REI. I just finished my fellowship at Case Western University. I did 3 years of fellowship there. I'm older because I took 2 years for my master's. And I also froze my eggs 4 times. So I also am like a patient and stuff too, and because I'm older and like not married, and that was really cool to like see how the process happens, like you becoming a patient. And I'm about to join a practice I love here. It's called Shady Grove Fertility. It's all over the country, but we have a practice in Atlanta, so I'm joining them in 1 month, and I can't wait. I just took my boards, and it's so great to be here.
Awesome, thank you. So just to reiterate, it's if you want to go into REI, 4 years of OBGYN residency, and then 3 years of an REI fellowship afterwards. I don't think there's another way to go into REI that I know of. Is there? No. Okay. Thank you. So now we're going to ask 2 physicians if they can share with us a little bit about what the field of REI is, because you are all talking like we all know what that is, but some of us don't. So let's have Dr. Chen, if you can share with us a little bit about the field and or like a little bit about what your typical day looks like.
So I'm in a practice that is at a community hospital, but does have residency programs and medical students, and we do some clinical research, but no bench research. And I'm one of 8 physicians, and so I take weekend call every 8 weekends, or 7 or 8 weekends, because we have to cover holidays, and then we rotate during the week. And call usually means that you go in Saturdays and Sundays, and first thing, 6:30 in the morning, I show up, and we used to have like 50 people in the waiting room on the weekends, and now we do everything by appointment because of COVID. So we have to get all these scans done for people doing IVF. So we're doing ultrasounds, I'm doing IUIs. When I'm done that, then I run to my OR and I do egg retrievals, where it's a transvaginal ultrasound guided needle procedure under a little bit of anesthesia. And we do the egg retrievals. Then I usually am all the people I saw that morning for ultrasounds. I will get on the computer and sit down with my nurse and go through those 50 or so ultrasounds, 100 or so labs from all the 8 offices, and say, okay, this person needs Clomid, this person can start, this person can't start, let's give this person a trigger shot, they should have a retrieval, this person, it's time for their IUI. So we do all of that. And then, and everybody has their day structured a little bit differently. This is how we do it, but we are broken up with, we're all probably doing ultrasounds, we're all doing IUIs, we're all doing egg retrievals, and we're all reviewing labs and making those types of cycle decisions and doing embryo transfers as a big part of what we do, because that's, those technologies help people get pregnant. Then in the afternoon, I'm doing embryo transfers, which are done while you're awake. And then usually at the end of the day, all the questions that were not able to be answered by my nurses, then I'm calling people and things like that. My nurses get to do the positive pregnancy test calls, and I have to do all the negative pregnancy test calls. So that's not always so easy, but it is a really nice field in that everybody, almost everybody who fails still has a chance to succeed. So we are talking a lot about failure and negative pregnancy tests because the per cycle pregnancy rates are nowhere close to 100%. But the overall global pregnancy rate is quite high for our patients if we can get them to hang in there, stay healthy in mind and body, and stick with the treatment. And obviously there's, we could talk forever about the obstacles like insurance and things like that, which I hope this next generation is going to solve. But it's a very optimistic field. We're dealing with mostly healthy patients and a lot of really good outcomes and a lot of hope. So that's really gratifying. Then on my other days when I'm not on call, I'm not covering the OR. I used to see patients in the office every day. And now I do a lot of virtual consults. So like Monday, I did 10 hours of Zoom. Tuesday, I was in the office all day doing ultrasound, seeing new patients, doing heart, lung, breast exams on my new patients, pap smears, cervical cultures, saline hysterosonograms where we put a little salt water in the uterus and look around. So that's, kind of what we do.
Awesome. That sounds really cool. Dr. Treebacks, do you have anything to add? And if you don't, maybe just clarify, like, do you still deliver babies? Maybe just clarify what IUI is and what IVF is, like really short in case someone doesn't know.
So IUI is intrauterine insemination, and that's where we take sperm that is washed by our andrologists who handle the specimen. And then we're taking a tiny little catheter and placing it through the cervix, and we're placing the sperm at the top of the uterus, giving it a big head start with the best sperm. The sperm still needs to find the egg and fertilize it. So that's one way that patients can improve their chances of getting pregnant. IVF, in vitro fertilization, is where we give our patients medication to get more than just a few eggs to grow, and we take those eggs out, mix them together with the sperm in our laboratory. That's the in vitro part. And then we grow our embryos in our lab before we put them back in, or before we freeze them, or before we do genetic testing. One other thing that to add to what we do, that in addition to what Dr. Chen said, is operating. And, in our field, you have really a lot of options. In the whole field of OBGYN, there are so many areas that you can find your own little niche and do what you want. Some people like to operate more than others, and you can do that. And there's a lot of minimally invasive hysteroscopies, which we're doing in the office. Sometimes larger cases we'll do in an ambulatory surgery center, laparoscopies, just the same. But I would say that very few reproductive endocrinologists are delivering babies anymore, unless someone else still is. When I was a fellow my first year, my fellowship director was Dr. Alan DeCherney, and he still was doing deliveries on his patients. And he went to Mexico, and he was like, okay, cover. And it was really my first week. And I got a call at like midnight, and they're like, you're got to come in and do the delivery on this patient. So I was so excited because I was like first sort of an attending, but I was really a fellow. And I took a shower and I put on some fresh, go in, and I stayed with this patient the whole night. I mean, I'm just labor. I mean, I basically camped out, no episiotomy, delivered at like 6:30, made it to clinic. I was so proud of myself. And my nurse said, did you call him? And I said, call who? And she said, did you call Dr. DeCherney during the process and update him on how far she was dilated and on the tracing? And I said, he's in Mexico City. And she was like, oh, you didn't call him? And I said, no. And she's like, you better go call him right now. And It was a really bad, it was my worst phone call my whole life. But I didn't do my residency at UCLA, so I didn't know that he likes to be kept up to date no matter where he is in the world throughout the whole entire laboring process. So that was interesting, but no more deliveries. We're making babies, and the patients usually, once they're pregnant, stay in our practice till about 7 or 8 or almost 9 weeks before they transition to their OBGYNs.
Interesting, thank you. So now I'm going to ask Dr. Keaton Val if you can share with us a little bit about your REI fellowship program and what a typical day looks like for you.
Sure. So I'm a little bit different from others on the panel. I am doing a combined fellowship. So I'm doing reproductive endocrinology and fertility with medical genetics and genomics, or MGG. And so that's a 4-year program. But the base of it with the REI portion of the fellowship is the same. Is the same that everyone else goes through. So as first year fellows, my program is into doing 12 months of clinical REI work. So that's where I'm in the REI office, I'm doing surgeries, I'm seeing patients, I'm doing ultrasounds, I'm doing ART procedures, so IVF, IUIs. And then I do 18 months of clinical genetics. So I'm seeing, it was so strange for me. It was like definitely a steep learning curve, because I went from seeing like all females, only females, to seeing children and men. And I was like, I don't do men, but I had to. So it was and children. I was like, I don't do children, I do men. So I had to do that in my genetics portion. So I saw, very sick children with metabolic disorders, as well as we had a dysmorphology service, and Hopkins is unique in that we have our own genetics inpatient service. So which is very busy. And I actually was more busier on call genetics than I was on my REI side of things. And then after that, it finishes up with 18 months of research. So, and that's combined in both REI and genetics. So a typical clinical day for me on REI would be, we start all our ultrasound monitoring around 7 a.m. in the morning. So as a first year fellow, you go in and you do the ultrasounds with with the attending physician. And you do that for about an hour and a half to 2 hours. And then afterwards, you go through dosing of IVF patients. So once we see what a patient's lab work are, our hormone testing, we see what their follicle size are and growing, we go ahead and dose the different IVF medications that we give them for their stimulation. And then I also would, at that time, if there was any intrauterine inseminations or IUIs, I would perform the IUIs in the office. And then after that, I would do like clinics. So if I was attending, or if I was on the surgical part of my rotation, I would go to surgeries in our OR. And like my first year of fellowship, someone I know asked on the topic to do any reproductive surgeries, and we do. So my first year, I think in the first month or so, I did like 4 or 5 Müllerian anomaly cases. These are women with MRKH who had like a uterine remnant or cervical agenesis, or something not right with the anatomy that we had to go in and correct and fix. So we do those type of surgeries. We do, like someone mentioned earlier, uterine septum removals. That's pretty clear with a hysteroscopic approach to that. Any type of if you want to do laparoscopy, we do laparoscopy. So hydrosalpinx, so you go ahead and remove the fallopian tube, as it can be detrimental to someone who's going through an IVF process, or if there's any type of cyst or anything that we do those as well. And then, so that's that's my clinical. And then if I'm not doing ultrasounds in the morning, I would go and do procedures. So I would do the IVF procedures, including egg retrievals and embryo transfers with my attending. Cool. So that's pretty much a day in the life of a
So can I say something? Dr. Kate Vaught is one. There, how many are combined REI genetics fellowships are there? Two, three. There are two. The other one is at Wayne State. Is that right?
Well, I guess Wayne State, I don't know if they're active or not. So there's Wayne State, the NIH has, I don't know if they have an active fellow right now. And then there's the one at Hopkins, which I'm the first fellow that started, and it is a ACGB, ABOG approved fellowship, which is the American Board of Obstetrics and Gynecology. And right now we have so I'm the senior REI genetics fellow, and we do have another fellow. So there's two of us right now, and currently we take a fellow every other year for the combined program.
Cool. And
so I bring it up because someone on the chat asked what's the future, and genetics is one big piece of the future of the field. So what can happen in the next 10 years? It wouldn't surprise me. I know, WashU, we've been flirting with the idea of adding a genetics component. COVID kind of derailed a lot of those plans. But I would anticipate more fellowship programs providing an option for genetics fellowships.
Yeah.
Eric, I don't know if you have any comments or anyone else on here.
Yeah, like why I did it. It's like the future of our field. It's what we're going towards. Everything that we're doing is based off of some type of genetic. And like in the field of medicine, like there is a huge component of genetic basis of disease, and we're learning that a lot of things that we're seeing in our field, not only in REI, but in medicine, has a genetic component to it. And so when we're doing, pre-implantation genetic testing, when we're doing tests like endometrial receptive assays that are based off of the genome of the uterine lining, those type of things, I think, are cutting edge. When we're doing CRISPR genome editing, we're not technically doing it in embryos right now, but that's kind of like the can we go ahead and remove a variant or a mutation in an embryo and then have a disease-free state later on? So it's like huge. It's very huge and vast, and I wanted it to be like one of at the top of that.
In the middle of it.
So that was like my drive for that as well.
Wow. That's so interesting. Thank you. And then it's 3 years still.
What did you say, Eliana?
Longer than 3 years, or is it 3 years? It's still 3 years.
It's 4 years.
Oh, it's 4 years.
No,
okay.
It's 4.
And the one at Wayne is also 4.
Yes.
Okay.
Because we have to do, in addition to the REI portion, we have to do 18 months of clinical genetics as well.
Okay. Cool. And now, Dr. Anderson, since you just started, is there anything that's different for you or in your program? I mean, besides the genetics part.
Yeah, I mean, I like the structure of our program because we spend 6 months with just clinical. So we're not doing IVF yet, but we're seeing new consults. We're really getting our feet wet and getting a good understanding of what the infertility or what the endocrinology workup is, which I like a lot because I feel like if I was trying to learn everything about new consults and everything about how to do IVF and cycles, I would be like drinking out of a fire hydrant, the classic medical student thing that everyone says. So I'm in the clinical aspect, which is great. So I come in, we have sonographers, which is a little different. So I come in and I work with the sonographers with ultrasounds. I try and fit in any IUIs, even though there's much less in the time of COVID right now. And then just see new consults with all the attendings and try and get my understanding and my bearings of it all. So I really like that. I'll be excited, I'm sure, to start the IVF aspect, but I'm focusing on the consults right now.
Cool. Well, thank you. And now we're going to gear the webinar to talk a little bit about how medical students and residents can make themselves competitive candidates to get into an REI fellowship if they decide to go into this field. So we're going to start with Dr. Foreman. If you can share with us what you believe to be the 3 most important things that makes an REI fellowship applicant a competitive candidate for a fellowship position, or that helps them stand out amongst all other candidates in the process.
Yeah, thanks. So I think there's a lot of aspects that go into making a competitive candidate and making a really great REI fellow and future attending. And I saw a lot of questions in the chat about like DO and foreign graduates and programs without fellowships. And there's definitely like very successful people in our field that meet all of those criteria. It's definitely possible. And I'm sure some of those people would be willing to speak to any of you and give you advice, and you could reach out to us and we could connect you with people that might fit something that you're looking for as a mentor. There may be different challenges, but when it gets to the point of actually you're an OBGYN resident and you're applying, I think there's several criteria. I mean, one that I think is important, and I'm at a program that has a fellowship, and I'm not the fellowship director, but we review the applications, we meet people. I think having the ability to follow through on like a project is important. So not necessarily having a million different things that you had very, minimal involvement in. I think if you have one or two things that was really you took ownership of, even if you're again at a small program and you use the resources you have. I've seen people do randomized controlled trials at small programs. They had an idea, they made it happen. It was small, but you could tell that they were really motivated and dedicated, and they made the most of their opportunity versus at a place that has an REI fellowship. So that yes, there's lots of projects going on, and I can get my name on an abstract that's at a meeting, but when you then probe, like, what did you actually do? Was it your idea? Did you delve into it? That's, I'm more impressed with the person who made the most of their opportunities.
Yep.
The second important criteria for me is like just kind of being normal. And maybe others can weigh in, but I mean, as an attending at I worked at RMA New Jersey, and then I came to Columbia University Medical Center. The fellows, you heard already, the fellows sometimes are the ones that are there at 6 a.m. or 7 a.m. that are seeing patients on the front lines going through some of the most stressful treatments of their lives. And if you can't interact with all different kinds of people, that's concerning, because you're gonna interact with my patients. You're gonna call them in the middle of the night when they're, when they're stressed out, and we want you to be friendly and normal and able to interact with people. So, if someone just, doesn't get along with people on the interview, if someone is rude to the administrator, who invites you for an interview, that's a big red flag, because you have to spend 3 years and maybe longer if you join our practice. And then I think letters or demonstrating your commitment are important, like letters of recommendation. So, one of the why is it an advantage to go to a place with an REI fellowship? Largely it's letters, because we see letters, we know who wrote them, or those people will go out and maybe contact other fellowship directors that they know and vouch for you. But if you can get, really strong letters, even from, places that don't have an REI fellowship, but we could tell that these are genuine, and they say, this is the best resident I've ever seen in 30 years, and they did all these things that no one else has ever done, that's impressive too. So again, like ability to come up with ideas and follow through, getting something published, even if it was a small project, you completed it, being able to interact with all different kinds of people and be personable, and then having good letters showing your commitment to this field. Those are the three things that I think really can make you excel at getting interviews and then matching ultimately, which is like another stressful process we can talk about later.
I think you're muted, Eliana.
Sorry, thank you. Thank you so much, Dr. Foreman. That was really helpful. So now I'm going to ask the same question to Dr. Omertag. If you have 3 things that you feel make a candidate impressive or stand out.
I honestly would just echo what I would echo what Eric said. I'm just kind of looking through some questions. It's research, opportunity, making the most of your opportunity. I mean, his examples are apropos. I like to see people who have grit. So anybody who's been in a situation, so if you have some situation in your life or your story that talks about a situation in which you were knocked down and you got back up, I like to see grit in applicants. And however, like whether there are a lot of different ways to demonstrate that. There are a lot of questions about what if I end up in a program where there's no REI fellowship. It's really about what did you make of the opportunity in front of you? If you transferred, what did you make with the opportunity? Once you transferred, if you didn't, there's evidence on this panel and all over the place. You can be a DO, you get into REI. You can not be in a program that has a fellowship and be successful. You can ultimately do this. And I think it's just stick-to-itiveness. And if it's something you want to do, you will do it. And reaching out to people, like using these venues, whether it's social media or emailing people directly, that's what this world is now. So just reach out, ask if you want to talk about your specific situation. I mean, don't hesitate to do it. The world is a lot flatter now.
Yeah. Wow, thank you. Kind of in this realm, a resident posted a question. Let's say her residency has crazy hours and there's no time to do research in residency, or maybe they don't have like that as part of their residency program. Do people ever take a year off and do research before, like in between residency and fellowship? Any thoughts about that?
A couple people on this panel, I think, can answer that.
Yeah, I mean, I would say it's very rare to take a year off in residency. It's not like medical school when you can kind of pause and continue, because the OBGYN programs are designed in a way where like you're working crazy hours because they need you to work crazy hours, because that's kind of the job to be done. So if you leave for a year to do research, it really leaves a big hole in the residency program. So I'd say that's usually the exception, not the rule. Say more common than that is you finish residency, you take a job as a generalist, which tends to be a lot less intense at residency hours. You can take a part-time job if you want, and then you can focus on building your research repertoire and doing it then. I would say that for the most part, I don't know any OBGYN residents who feel like their programs weren't crazy and had crazy hours. Of course, some are busier than others, but I think that's part of what a lot of people have mentioned. You have to kind of have that come across in the interview, and people understand that, and it's a small community. There's only so many OBGYN programs and so many REI programs. So when you apply, they know where you're coming from, and they can put your application in perspective in terms of where you came from residency. So if you came from a really intense program and you have 1 or 2 projects, they know those were really hard to complete. But I'd say the majority of residents feel that, and like Val, leave clinic at 6 p.m. and then spend 3 hours at night or spend your weekends doing that. And that's just kind of what you often need to do in these busy situations.
Can you add to that, like if you could explain like how many REI fellowship programs are there across the country, or like how many spots there are if someone takes 2?
I don't know the exact number, to be honest. I think it's probably in the like 50-ish spots a year. The majority of programs take 1 fellow a year. Some programs take 2 fellows a year. Those tend to be a little bit bigger. And I'd say the majority of programs take at least 1 fellow per year. There are some that skip a year here and there. So that's about the number of programs that there are. I don't know if anybody has a more exact number.
I think you're right. And I also think it's important to state that I think in the past couple of years, there have been about like 80 to 100 applicants. So it's not like there's 500 applicants for 40 spots, you know, like you have there's a chance that if you've come this far and you've created an application, then you have a good chance of getting it, you know? So don't worry, it's totally possible.
Yeah, and to speak on like coming from a program that didn't have REI, so my residency program didn't have it. We did rotate through REI actually with Shady Grove of Maryland and Baltimore. So getting in with the people, if any opportunity you can get, it's, you know, you just try to do it. And like what Dr. Omertag said earlier as well, like the distance between people has dramatically decreased, opportunities out there to reach out to people. But then after, in my instance, I did 2 years of actual research in a reproductive science lab after I finished residency. So I finished residency in 2015. And then my husband, who's also a OBGYN, was doing MFM fellowship at the time. I had finished residency, and we didn't know where we were going to end up because we're both not from Maryland or at all. We had no family here. So I was kind of off cycle with him. So I wanted to wait to apply when he was finished with fellowship as well. And that just ended up me taking 2 years. And luckily I had the opportunity presented to me to be a research fellow under Dr. Jim Seegers, who's like amazing and like so well known in our field. He's just been an excellent mentor to me. So I also encourage you guys to reach out to people and to establish that mentoring relationship, because there's so much opportunity out there.
Can you just explain what did you do in between residency and applying to fellowship?
So I did 2 years like in a basic science research lab. So I did bench work. I never did before in undergrad, because I was dealing with cell cultures and mice and a lot of different things. And so, but honestly, it's built upon like so much and has propelled me to actually think about having a research career after I finished fellowship.
That's really cool. Thank you. And
yeah, let me just add that I just wanted to add that Dr. Kate Vaught's experience is not atypical to the question about research opportunities. You know, sometimes with your spouse, other circumstances, doing a fellowship right after residency doesn't, you know, just logistically work out. So people will seek opportunities, whether it's another, you know, like a part-time private practice gig. Private practice can be busy. So you got to find the right one. And more commonly, people who are motivated to do a fellowship will look for some research opportunities that will kind of put them in positions that more align with their, you know, with their schedule.
So would you say research is the most important, like, key if you're taking off in between residency or fellowship, or let's say you don't get in the first round? Is that one of the most important things to do?
I don't think, I wouldn't necessarily say it's an important thing to do. It's you want to show a commitment to the field. And for a lot of people, doing research is an easy way to do that, because there are a lot of opportunities to find research that will align with your schedule. I mean, if you told me you were going to go work at the White House and do policy on reproductive health for a year and then apply for REI fellowship, thank you, I'll take that. So it doesn't just have to be research per se. I mean, there are a lot of people who have made their name in the field just by doing research on policy. So it doesn't have to be bench, it just has to be a commitment to the field. And there are a lot of ways to demonstrate that.
Thank you for explaining that. If we could go back to Dr. Harrington, if you can share with us 1 to 3 things about yourself that you feel made yourself stand out in the application process, or if you noticed 3 different things that you've found important as someone that recently has applied and gotten into a fellowship.
Well, I don't know, I like to brag, but I think the things that I was told that would be helpful were, number 1, like, make sure you become a good doctor. So like residency, yes, you are working towards a different step. And if you know you want to do REI, it's fine to know that you're going there, but you're taking care of people and you're learning a lot of very important skills that you're going to need both as a physician, as an REI fellow. So it's really important to first and foremost, make sure you become a doctor, you learn the science, and you learn how to take care of patients. I think I did a good amount of research in residency, but I try to focus on projects that I found interesting. You will find that if you're just doing something to check off a box, you will not be as engaged, your work won't be as good. Earlier in your career, you can be a lot less picky because a lot of it is out of your control. Sometimes you have to take a project as you get it, but you will find that as you delve into something, you will become more interested and it will become a lot more fun. I think what Kenan said is really true. Like what we are looking for is for someone who like finds something that they're passionate and follows through with it, and it's really important to kind of finish what you started. Like Eric said, like if you have a million things going on, it doesn't look good. We want to see you start something and complete it, because when fellows are around, you need to complete your thesis, you need to complete your project. So that 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 idea of starting a project and finishing it is really important. And I think that the third thing, and I don't think this can be overstated, is to be prepared for your interviews. I think most of the hard work is being a resident and doing the applications and getting your creogs and doing all this other stuff to get into fellowship. But if you show up the day off and you start asking questions that are in the first page of the website, or you don't know like who you're interviewing with, or you don't know the structure of the program, even though it was all online, that does not look good. So I prepared a lot for interviews. I practice my answers. I look at the website. I reread the website the day before. I try to find out, you know, what are the faculty doing? What are the strengths of this program? How many papers have they published and it's what? And doing as much research as I can online. So when I show up on the day of the interview, I am really prepared to, you know, clearly state like, this is why I want to come to this program and this is what attracts me to it. So those are a couple of things that I think are helpful.
Thank you. Dr. Levine.
Can I just say one other thing? I'm sorry.
No.
One thing I wanted to add is that people at the beginning of residency there's some questions on the chat, like what should I do as an intern? What I tell people is, as an intern, learn to be a good intern, learn the system, build trust with the faculty and your co-residents. And then in the second year, expand on that trust that you build with them, and then start to let people know you're interested in fellowship and whatnot, and then cash out in your third year by leveraging all those relationships. And then you have the fourth year to kind of rest a little bit, if you will. So focus those first 6 to 12 months in residency on just being a good resident. Don't get too stressed out about like, I got to let everyone know I need to be an REI fellow or whatever fellow it is you want to be. Just focus on being a good resident first. Don't lose sight of that.
Dr. Omertag, do you have anything to add about for medical students? Like what?
So for medical students, I would say the same thing. I mean, work on, you know, I think focus on finding a good OBGYN residency based on all the criteria that we talked about. I don't really have a special, like, you know, state one-line phrase that I just gave that it's designed for residents. For medical students, it's more broad and just focus on building the relationships to find what a good program is and work with the clerkship director and OBGYN. That could be a good place to start.
Okay.
I was going to also, if I can add on to that, actually, I thought Eduardo had a good point. I mean, I remember this year it's going to all be Zoom, but when we were flying around to all our interviews, like 11 years ago, Dr. Omertag and I are in the same class. I would print out, you know, their bios, their PubMed, and actually an interview experience was real learning experience. See all these different places and meet all these people and see what they were doing. And also the fellowship class. I mean, I met people that now 11 years later we're still friends, and like colleagues, and even my current division director who recruited me where I am, he was a fellow and we met. I remember I didn't even go to that fellowship program, but in like the waiting area when you're just like meeting the fellows, just talking, we talked and he remembered me. So like, don't take anything for granted. Even kind of I knew where I wanted to go for fellowship. I did like 5 more interviews and spent a lot of money, but kept meeting people and like didn't regret any of that. So obviously this year is going to be different. Hopefully, I mean, I'm sure by the time you all are interviewing, there's probably going to be some virtual component, but hopefully you're able to meet other applicants and learn about the programs. And like Eduardo said, I mean, by the time you get to the interview, really, like your step one scores and stuff like that, I mean, that's all relevant, like to just get to that point. But then it really comes down to, like, again, are you really interested? Do you seem like you're a good fit? Is that a place that you would really want to go? But you have to put in all that legwork, like Dr. Omertag said, and get to that point that you are a good candidate and you get into.
So just a question on that. Would you say that fellowship programs still look at resident step 1 and step 2 scores from medical school? Or do they focus more on the residency?
I would say focus on residency, because that's, but I don't, we don't have a fellowship program, but I feel like, you're looking for people who can be good doctors, not necessarily good test takers.
Yeah, I would say that at the fellowship level, at the residency level, yes, I think they do. But once you get to fellowship, I think the things that matter the most are, what do the people that work with you think of you? So your letters of recommendations, can people vouch for you or not? And then, what have you accomplished in residency, like research-wise and other activity-wise, is much more important than scores. CREOC scores, I think, are hit or miss. They're technically not designed to assess performance. They're designed to kind of help you figure out where to focus your learning. For those that don't know, CREOC scores are in-service exams that you take every single year in residency for OBGYN. However, some programs do look at them sometimes. So you want to make sure you put in some time and get a good score, especially your third year before you apply.
That I did not know. Mommy put soap on my
And then I think we can hear your babies.
Okay. It's soft. In fact, it's really soft.
Dr.
Yeah.
Okay, can you hear?
Yeah.
If everyone who's in the class is maybe I can mute them.
Say that again, Eliana.
I'm just gonna mute all the panelists so that we can hear you. Hang on, because there's a lot of background. Okay, now it's stopped. Okay. Your kid sounds really cute, whoever you are. Dr. Libby, if you have anything to add on that subject, if there are 3 things that you felt made you stand out that Dr. Harrington didn't mention, or if you want to add to that, when you're applying to residency, is it okay to be upfront that you want to do REI, or did you just focus on you want to do OBGYN?
Yeah. Okay, so I would say the 3 things that you should focus on as both a medical student and a resident. I agree with what everyone said, but to add a little bit different, but be a good person to your colleagues, to your staff, to your attendings. Like, do not be arrogant, be helpful, be nice to everyone, because you don't know who knows who's going to be interviewing someday. Really be that good person to everyone, as much as you can. Because I've had people come in, residents say they want to do REI, and you're like, I'm sorry, you are not a good person. Like, you have to be a good person, and be nice to everyone. And then network a lot, like I did and love to do, just talk to everyone, utilize your resources, talk to people, and ask them for help. Ask them, like you do so well, Eliana, like you network really well. You're talking to all of us as a medical student. I mean, it's amazing. It's amazing. So, I think that is huge and it can help so much. And so use that, and then show dedication to the field of REI. Some people don't know till they're in residency they want to do it. Some people know early on. For me, I think if you knew early on, sure, go ahead and say it. I went to UT Southwestern and told them I was going to go into REI. It's fine. I mean, they're really big on making good generalists. So basically, like, if your story starts early on, or if it starts later on, whenever you realize it, just like show dedication and do all the research. that you possibly can. Or if you don't love research, do the advocacy thing. Whatever, like everyone has said, whatever makes, sparks the love for REI inside of you, really stick with that and find your niche that will really help you stay dedicated to it and show that you are.
Thank you.
One thing that I wanted to add is a lot of people ask whether you need to do research in REI, and the answer is no. You need to do research on whatever you're interested in. Well, what people are looking out is whether you're inquisitive, whether you are interested in answering whatever question you put in front of yourself. If you were into MFM and came into residency and you were going to be an MFM or a generalist or whatever it is, and third year you do your rotation, you're like, wow, I really want to be an REI, but I don't know if I can do it because I did all my research in MFM. It doesn't matter. Like, as long as you have a good story and you can explain, we know that if you could do it in MFM when you were interested in that, you're going to be able to do it in REI as well. So don't feel like you need to redo your whole research portfolio or no one will believe that you want to do REI. This is your life and you're applying, so we know you want to do it, and everything that you've done up to that point will count, even if it's in a different field.
And to piggyback on that, it's all about, like they said, following through. And I feel like a lot as medical students, what does that mean? What does following through mean? So the big thing is find something you're passionate about or that you like and start from the bottom. If you can help with writing the IRB, that's really good to be able to get that experience, to work through the data. Even if you have a statistician, work with a statistician to know and understand how this data is being run. Then try and get an abstract out there, try and go to a conference. Once you go to a conference, you can talk with people, great networking opportunity. And after you're done with that conference, don't just say, hey, I got an abstract and I'm done. Take that abstract, turn it into a paper. It does not have to be published in the green journal or the gray journal to mean something. As long as you're passionate about it and you've gone through the whole process from collecting the data, analyzing it, and writing, it really is what is complete and what so many people are looking for. Don't just stop at one of those areas. Finish it up, write the manuscript.
Thank you. Yeah, I saw a lot of questions people were asking about what does it mean to do research, or is presenting an abstract at a conference considered research output, or only publications count? So you would say it's anything that you started and were able to finish, it doesn't really matter?
I think going to conferences is great, and I think that does mean a lot, but that's not the end. The end is trying to kind of write something up. But conferences are definitely great. They're great opportunities, and they definitely are counted.
Thank you. And then someone on this same subject, does research or publications from gap years, if you took during medical school, you took a gap year, does it count in terms of on your application to get into fellowship, or is it just mostly things you actually did during residency? Does it all count?
It all
I
counts.
think it all counts, but it has to show some consistency and some persistence.
Yeah.
So, if it all is part of your story, as Dr. Harriton said, you need to present yourself, and so I do think some kind of honesty and integrity and authenticity definitely can, connect with the people that you're interviewing with, and that can make a difference where you can sense somebody's genuine, dedication and interest and passion for a particular area. So we're not looking for a specific formula, but there's somebody has a spark and an energy that always sticks with you when you're interviewing candidates for positions. So I think it's also, I was also struck by what Dr. Libby said, to be nice to everybody. We have a very, very nice field. We do have a lot of really cool people in this field, and it's actually very small. So we all know everybody, and we interact a lot and do things like this and other things together on a regular basis all the time. And it's also strong social media community, because our patients, they're very much looking to social media to connect with each other for support. And so a lot of doctors, especially a lot of the younger doctors, are very, very active on social media because we found it's a great way to raise awareness, educate, and advocate. So it's a great field from that perspective, and getting to know as many people as possible, I think, is possible because it is right now a relatively small field. Although I do think there's huge potential for expansion, and so even if somebody doesn't actually do a reproductive endocrinology fellowship, I think all of us in the United States are going to be there. Just reproductive medicine and genetics, these technologies are just growing like crazy. And so I think it's a very exciting place to be.
Yeah, I agree. And I also would like to say that it all does count. All of your research counts. But for me, like, I did this research in Kenya for 2 years before I ever went to med school. By the time I was applying to fellowship, I wasn't going to spend time talking about that. Yeah, it was amazing. And like, I could talk all about that, but really I need to talk about why my REI research or my OBGYN research, that is way more. I mean, I'm not going to talk about research I did when I was 22, when I'm 30, 31. Like, so you want to, it counts, but like, you need to continue to do research in residency. You need to continue to show that you can be a really busy OBGYN resident, a really busy medical student, and add on research. I mean, it's hard, but like, or add on whatever, gets you going. So you got to show like current, stuff too.
Thank you. If we can now focus a little bit more about how medical students and residents can use social media to help them learn more about the field of REI or find networking opportunities or research opportunities, because I know a lot of medical school programs do not have associated REI fellowship programs or REI offices or any opportunities for their medical students to learn about the field or gain mentorship in the field. And same with certain residencies, they don't rotate in REI if they don't have an REI office or fellowship program available to them. So Dr. Foreman, do you have anything to add on that?
Yeah, I mean, I think, you can follow a variety of different people on these different platforms like Instagram, Twitter, and maybe get like a little bit of that, like what's the day in the life. Some doctors show more about like what they're doing on it, like I'm doing retrievals now, or little like educational things like Dr. Chen mentioned, like what is PCOS. There's things like that, maybe are a little bit more practice-based than like reading about it in a textbook. And then you can also reach out to people, like some have put on this chat that, you can send messages and ask if you could shadow them or get advice. Like I said, if you see some similarity, if they come from a similar background, I'm sure a lot of us would be willing to set up a phone call and mentor. So that's how I think it can be potentially useful.
Yeah, follow us, right? Follow things that you're interested on Instagram or Twitter or whatever, and reach out, because I think everyone here, and like Dr. Chen said, our community is small and we're very friendly and welcoming. Like even for like at Hopkins, there's research opportunities for visiting medical students as well as for visiting residents. So email me, I can hook you up with Dr. Seegers. I mean, he's amazing, and he does have medical students come all the time in his lab as well as residents. So even just being here today is the beginning, and starting showing your interest and seeing us all here. You guys are doing an amazing job.
Thank you. Dr. Chen, do you have anything to add on it?
I'd like to make a little plug for people being also not only connecting with everybody here on Instagram and following all the people that we follow and connect with, but there's also an active community of social media doctors on Twitter, and Twitter's a little bit more doctor to doctor, maybe a little easier to do research, networking type connections and things like that. They work a little bit differently. So I do think both of those platforms, those are my two favorite platforms right now. I did one TikTok. I don't think I'm gonna that's not really my thing. But, and then I would say LinkedIn, honestly, is also, I feel like every doctor should actually have a LinkedIn profile, at least something basic, who you are, your name, your contact information, and your training. I think everybody should have that, and everybody on, you know, you should just start now, just put it up there. And your Instagram and Twitter handles, you can start with your name now. Even if you don't have an MD yet, you can put MS2 or MS3 or MS4 or whatever you want. You can change it and still keep the account. So that's a nice little thing you can do. And I would also like to make a plug for everybody to join AHSM, Association for Healthcare and Social Media, because social media, I think, is, you know, becoming a bigger and bigger platform for healthcare information and connection and education, and hopefully also healthcare reform, change, and advocacy. And we'd love for everybody on this seminar to join AHSM. It's a brand new organization. I think their first meeting is coming up soon. It's very cheap for medical students and residents. And we're looking for people to join committees and get involved, because this is, we do obviously need a lot of help in terms of our broken healthcare system. And you guys are the future. We're hoping you're going to help fix it. So please, you know, join that. I'm going to put it in the chat, AHSM. So,
Dr. Trevax, do you have anything to add on using social media to benefit, like for medical students and residents to be able to benefit themselves, to gain mentorship? And
I think that you're a great example of someone who's a medical student who's just sort of taken the ball and run with it. And the opportunity, you don't even need to be as prolific as you and have a different group and be so involved, but you can really find people that you can connect with. Show your ambition, be ambitious in what you do, whether you're networking, whether you're researching. You need to find what works for you. And yeah, if you go to a medical school or a residency that has a fellowship, it's a multi-year opportunity to be interviewing almost every day, because you're interacting with people that are looking for fellows that they want to be around. When you go for a residency interview, the residents are really looking, who am I going to be around for the next 3 or 4 or the next 4 years? And they want to know, besides everything that you're bringing to the table, because if you're at the interview, you've chucked off the things that you need to. But I like to know, are you normal? Can you have a conversation? Because we can all do the work. If you go through an OBGYN residency, you can handle hard work and long hours, and that's nothing that won't phase you. But it's the other things. And I think social media, you can connect with people all over the world. And more so now than ever before, there's so much information on REI and on fertility. Every patient is documenting their journey from every needle to every single visit in the doctor's office. But for students, you know, you really have the opportunity to connect with other students with similar interests and use the people maybe a couple years ahead of you for a little more guidance too.
to add to that, I know that at Stony Brook and talking to other students from other medical schools, that their school has this too. There's like an alumni committee or some sort of alumni association. You can reach out to like someone in the medical school in the like registrar office, and if you tell them like if you're interested in a certain field, I did that. I was interested in REI. I got in touch with an REI physician who was an alumni of Stony Brook, actually Dr. Stelling, Dr. Freebax. So they'll connect you, and that's like another way to find people if your school doesn't have like a program.
You just have to take the time to say, I want to do this, and nothing's going to prevent you from doing it. And just keep knocking down the walls and knocking on doors, and you'll get where you want to be.
Thank you. Does any of the fellows have anything to add that they found, how they found social media to be useful for them in terms of finding networking opportunities or just in general?
I think that it helps. I feel like it helped me with my application for a job because you know, now it's still like the early stages of social media. Older people are like still like, you know, slowly stepping into it. And if you can show these people that are running large practices, whether they're private or academic, and they don't really know much about social media and they really want to get involved, and you can say like, look, I have a big social media presence, like I can help you with that. And that's your niche. Like that helped me. And in addition, I met people that I never would have met, like Dr. Omar Tag and Serena Chen. We just connected through Instagram, which is awesome. So I feel like definitely like you can connect with all of us too. And it gives you that niche. Like all the doctors know, every single doctor that's an REI doctor knows that it is a huge advantage to have a presence on social media. So if they see that you have that and they don't even have that, that's an advantage that you can help them with. You know, I think it really helps for me.
Now we know each other in real life. Okay. So we're not just Instagram friends.
That's true. Friends forever.
Let me add on to that. As a medical student who's savvy in any kind of technology or social media, you could leverage that to talk to the dean of students and say, hey, I want to put together a workshop. I want to work with the med public affairs of the university, and let's coordinate a process to help make social media really easy to do. So just a way to leverage if you have a special opportunity. My God, this is what life is like these days. So
I'm taking a picture. I'm taking a picture and going on social media.
Okay. So this is what life is like as a REI faculty 9 years after I finished fellowship. So this is what it's like. Many of you can relate. Anyway, I surely couldn't when I was in medical school, but I do now. But anyway, if you have a special skill, again, we talked about research being important, but if you're like, no, I leverage my skills in social media and I worked with the university to put together this workshop and teach faculty how to do it and use it to educate patients or to educate each other, then it can be a really helpful thing. Okay, I'm done. I think you get the point.
Thank you. Does anyone else have anything to add on that social media topic?
It's also just nice to see, like, and for me, like people say, like, you know, what can you bring to it? But for me, I've learned so much as well. And just the representation, it definitely matters. So seeing other physicians that look like me, who've undergone my experience, who I can see and follow. And that is huge, especially when you come from maybe places that don't have a lot of people who look like you, or maybe have your experience, and just to see that connection, right? We think about like social media as, you know, maybe distancing us from people that are around us in our daily lives, but there is some added advantage to it when you can connect with people that you may not have before. And for me, that's been really huge to see that, and empowering at the same time.
That's awesome. In terms, we're also getting a lot of questions in terms of work-life balance, like the difference between like work-life balance as an OBGYN physician versus as an REI physician. And in general, as an REI, like, do you have time to have a family, or I guess have a family out like as an attending or during fellowship?
I can answer that. I mean, I think I had my daughter during residency, and I feel like there's no good time to have a family or bad time. It's just whatever is right for you at whichever time is right for you. It's always going to be busy. It's always going to be crazy. And yes, in some phases of your life, you have more or less control, but it's going to be hard no matter what. In terms of work-life balance, once you're, in training, I think your work-life balance is much better in fellowship just because of the nature of the job. REIs don't often work overnight, whereas in residency you will be doing that pretty frequently. And then once you get out in practice, it just really depends on the nature of the job that you take and how you do your work. You can work all day nonstop and every weekend as an REI, and you can have like a very light laborious job as an OBGYN. In general, it tends to be a little bit heavier in OBGYN just because it's a bit more surgical on average, and you do a lot more labor call, which can be more intense. But I think it's kind of what you make it. And you, once you get out of training, you can figure out what are your priorities, how does that balance with how much money you need to make to live the life that you want to live, and then craft your career around that. And speaking of work-life balance, I'm really sorry I have to go eat with my daughter, which I do every night. So I'm gonna jump. It was really nice to see all the panelists. It was very nice to talk to all of you guys out there. Feel free to message me, send me an email. I'm happy to help in however way I can.
Yes, we're
And
going to
thank you, Eliana, for organizing this amazing panel.
Nice to see you, Eduardo.
Bye-bye.
Nice to see you.
Yeah.
Thanks, Eduardo. Good to
Thanks,
see you.
Bye.
Eduardo.
You too.
Gracias. Buenas noches.
Ciao, ciao.
I would echo those comments. I mean, it's always busy. My wife and I had a child in medical school, one in residency, one in fellowship, and she didn't want to keep going on as an attending. But so we have three. But obviously having a partner who's supportive is very helpful, or preserving your fertility, like we heard about, is important. But it does. I think we're focusing on just like getting into REI fellowship, but goes by so fast. You have to obviously really make sure this is really what you want to do, and then it's the rest of your life. But just as another anecdote, like, I mean, in medical school, residency, I didn't exercise at all. Like, I was very, studied a lot, did research, went to meetings, and finally, I think as a fellow, I did like a 5K at the ASRM conference. I started exercising a little bit. I'm still not like crazy, but I actually, as a campaign, as an attending, I built up to run a marathon and like raise money for a women's organization, and that kind of built up like a social media presence. And now I'm on Peloton, and I see like Valerie and other REIs like around the country. We like are on there at the same time. So there is a lot more to just being an REI applicant. You want to build the rest of your life, make sure this is really the field that you want to be in. And if so, it's an amazing field, and that passion will come through, and you'll get in somewhere, and then you'll have a niche somewhere. So I also have to run, but it was really great. Thank you, Eliana, for inviting me, and see many of you in person once that's safe to do so again. Thanks a lot.
Thank you
Have
so
a good night.
much.
And my contact's in the chat over there. Thank you. Bye.
Hi, Eric.
See you, Eric.
Bye. Thank you.
See you, Chief.
And
Bye.
also speak a little bit to it, as I am a mom in fellowship. So I have a son, he's 1 year old. He just turned 1 in the beginning of July. But, and I wanted to also speak to like, not even just work-life balance, but just in general. I know there were some questions in the chat about having to go through OBGYN residency, and then, picking it. I really want to stress, like, you can make your life what you want it to be. Like, if you want to be an OBGYN and you want to be a laborist, you could just deliver babies. You can work 3 shifts a week, 12 hours, and be considered full-time. If you love surgery and that's all you want to do, you can do exclusively GYN surgery. And so, like, it's very, like, that's what I love about our field. It's so varied. Like, even with OBGYN, you can do and make of it what you want. And then, like, going through each step of the process, it's so important, like everyone else has mentioned here, just to keep that balance in your life. And I know I'm just answering some other questions in the chat, but like someone asked about, I'm older, I have like, this is my second career being in medicine. I've trained with and was my co-resident. She had like 2 kids, had another job, another career, and then she decided to be OBGYN. It's totally doable, and it's not unheard of. And I don't think anyone's going to really discriminate based on that. If anything, that shows your grit and your toughness, that you decided to pursue something that you truly do love. And so I think I encourage everyone from all walks of life, no matter how old you are. I think even our incoming fellow, she's 40. So like, and she's our first year fellow here. And I think it's just, you like, don't let that discourage you in that aspect. And then do things that you love. Like my husband, like, I don't know how he does it, but he makes time. You can make time for things that you want to do, right? Like he gets up like at 5 a.m. and works out at 5 a.m. and then runs. And then he goes, like, he's MFM and critical care. And then he does like all these high risk things. And I'm just like chilling in my PJs. eating ice cream. So like, I like eating ice cream. He likes working out. So, you can find those things that you love and you can still make time for it. And in the field of REI, definitely you can do that.
Thank you. Anyone else have anything said on that subject? I'm gonna see if there are any other questions that like pertain to everyone. In terms of COVID, with I guess how like fellowship applications, or not applications, but the interview process is going to change. If you know anything about that, or in terms of like OBGYN residency, I know you're a little bit farther from there, but if you know anything on that subject or have any thoughts.
Okay, so I would say that, I mean, I'm not interviewing people this upcoming year, but I know from what I know, a lot of programs are taking internal applicants for REI fellowship this year more than previously, which means people can't interview there because they take them outside of the match, which is unfortunate, for the applicants this year. So I would personally say that it's going to be a hard year to apply to REI fellowship. Residency, I have no idea. I do think though, for this upcoming year, whether it's residency or fellowship or whatever, if you really want to go somewhere, your top 5 programs, email them, call them, talk to them, tell them how much you want to go there and why. They need to hear from you. They need to annoy them. Like, I mean, to an extent, I think that helps, to show like a lot of dedication, but maybe someone else has other thoughts, that's my thought.
Valerie, when you think you're being annoying, you're being cute. So I'm not sure other people should be annoying.
I feel like piggybacking off that, like just go out and hustle as much as you can during this interview process. It's going to be via Zoom. It's going to be more awkward, but that means you find these other platforms like social media platforms. Like basically every residency, every fellowship has their own social media handle. Plenty of the physicians and fellows have their own handles. And that's how you get to know these people. I mean, you unfortunately won't be able to be sitting out to dinner with them or meeting people in waiting rooms and things like that. But you have to find another more creative way to get to know these programs, to find out what's a good fit for you and where you're going to fit in best. Because that's the biggest thing about a lot of these interview processes. Where are you going to interact with these people and bond with these people the most, that you can spend 4 grueling years of residency or 3 grueling years of fellowship with. So you got to get a little creative. You got to hustle a little bit, but hey, you're all med students. You've all done it already. So just keep doing it.
Thank you.
So I'm going to sign off now. I really, really enjoyed just hearing everybody and, seeing that so many amazing questions. And Eliana, thank you for being so organized.
For joining. I know it's getting late. It's already 9.
Yeah. So, but I think Eliana posted all her handles on her post. So you can, we all love having followers and getting messages, and, again, would love for you guys to join the ahsm.org and connect.
Thank you.
Bye, Dr. Chen.
Bye.
Bye.
I feel like I'm gonna go need to eat some ice cream now after. Oh yeah, that sounds so good.
Me too. I wish I had some. Okay, I'll answer a question. Are there any programs that allow for MIS training in addition to REI training? I know Case Western, for example, has such huge surgical training in addition to REI. So there are certain programs that are really heavy in surgery. You just find out when you're interviewing how much surgery do you do and compare it to all of them. You make a spreadsheet. And you really find out the numbers, but there are a lot. Okay.
About the difference in practice between academic and private. Is there?
Sorry, I can't hear you. What'd you say, Eliana?
Difference between academic and private.
In terms of REI.
Like as far as,
I guess pick the environment you practice, academic or private clinic. I don't know in terms of REI if there's such a thing as academic, or is it mostly private practice, or is it combined?
So there's definitely such a thing as academic. A lot of the REI fellowships are academic. Are academic and are, functioning fertility clinics. I'm biased. I'm going into private practice. If you like research, if you like to have a set hours, and if you like the help of residents and you love teaching, you do academics. If you care more about just the patient interactions rather than teaching, if you don't like research, if you love IVF but don't love huge surgeries, those are reasons to go to private practice. As far as work-life balance, I think both of them, all fields of REI have a great work-life balance compared to any other field in REI and OBGYN, in my opinion. I think the hours are typically 7:30 to 4 or 5 p.m. every day. You may take a little bit work home, but not much. And then on the weekends, you're on call like once every 3 or 4 weekends. And usually nurses take first call in the evening. So that's what I've seen. It's a great work-life balance. Anyone else have anything else to say?
I'll expand on it. I agree with Valerie. I mean, the points she makes about the differences are pretty apropos. It's all about money for universities as well, and they generate money by seeing patients. Let's not be naive about that. I always ask people, how do you want to make money? Do you want to make money seeing patients, or do you want to make money asking people to give you grant funding so you can do your research? So that's the traditional difference between academia and industry, regardless of what field you're in, whether it's medicine, engineering, whatever. The nice thing about medicine is there's so many opportunities to earn money. So in academia, in REI, you're going to be clinically busy. You're going to have to see a lot of patients. If you're hired to do that. If you're hired because you have grant funding or you have the ability to get it, then your pressure to see patients is less, because no one's relying on your income from the time you spend seeing patients. Your income comes from some other entity that has granted you funding. Private practice has all the same opportunities to some degree that academia has. Academia has all the same opportunities private practice has to some degree, and they're all a little bit different. So it's important to just find what works for you. People have asked me, I'm very busy clinically, why do I stay in academia? It's because I like the variety of academia, and I like being able to do something different every now and then. Someone asked, are there mundane things about what we do? Not really, but I have the kind of personality where I like to try something else. And academia, at least where I am, gives me the freedom to have a busy clinical practice, to earn a really nice salary, but to also have the opportunity to decelerate and do other things.
Yeah, and I think there's, in our field, there's not as many available academic opportunities compared to private practice, right? There's a lot more private practice clinics out there than academics, because like what Val mentioned earlier is that, pretty much most of the academic REI centers are associated with the fellowship. So if you're thinking there's only like 30 or 40 of those in the country or so, you can imagine like when you're coming out, and people in our field tend to stay in it for a really long time. They retire really old because our field is very interesting, and it has, like you said, a great lifestyle balance. So typically the positions, like an academic position, is not coming open as readily as a private practice job. So that's also something to consider. And then I wanted to address somebody's question in the chat. They said, well, what about public service loan forgiveness, right? So that's where you do 120 qualifying payments. You have to work for a either not-for-profit or a institution, so like a academic center. And I'm currently undergoing that. And then if you think about it, like 4 years of residency, right? 3 years of fellowship, that's 7 years you got already underneath your belt. And then I did another 2 years. I was like, so I'm at 9, right? So like there's definitely that opportunity to get that if that's something that you choose to do, especially when you think about it in that instance, when just putting together residency and fellowship, that's 7 years right there. So I wanted to mention that to who asked that in the chat.
Leon, I'm going to check out. You guys, thank you.
I got to run too. Thanks a lot, guys.
You guys online?
Thank you, guys. Nice to meet you.
Yeah.
See, this is the advantage I have when my baby goes to bed at 7. Then it's like I can do whatever I want with my time.
Yeah, that's awesome. This is the advantage I have when well, one of the only advantages you have of not having a family at 35. That's why we're in IVF. I'm responding to a question right now about, it was a really interesting question. Cameron Holmes asked, in deciding about fellowships, it seems that with each fellowship, you give up an aspect of practice. For example, in MFM, you focus more on OB, and gyn-onc, you focus more on surgeries. What areas of OBGYN do REI physicians focus on, and what do they give up? I love that question. So, I mean, as a fourth-year medical student, you probably don't know this, you know, but that's a really important question. And things that you learn, even if you love REI, and that's why you go into OBGYN, you learn that you have to give up some things that you learned in residency. Like, for example, you give up delivering babies, which I loved doing, but most REI doctors don't love doing that, but I just love doing that. You give up huge, long surgeries, which I love operating, but you give up doing that. You give up taking care of people with cancer, which is also very gratifying. What?
Once you do fertility preservation.
That's on the fertility. I'm sorry. You give up curing cancer, but you can certainly help people that have cancer. That is true. You gain, or you really focus a lot on the hormones and the gynecology, like things that you see with menopause, transgender medicine, that kind of stuff, knowing about birth control pills, knowing about menstrual cycles, that you really have to know a lot about. But you also have to know a lot about obstetrics and like MFM stuff, because you have to know how to do really good early ultrasounds with the transvaginal ultrasound probe. And you have to know how to take care of miscarriages. You have to know what medicines you can and can't take during pregnancy. And you gain the opportunity to have like really amazing psychological discussions with your patients about fertility and like being a part of their creating the family that they desire in some way. So that is like such an amazing thing. But those are the things that you really have to be willing to give up. But you also gain a really amazing work-life balance. And that's also important too. So anybody else?
Yeah, I mean, I agree with what Val said, essentially, like, you know, and it's kind of what I alluded to earlier. I mean, even though you may not be like delivering babies anymore, but if you're really interested in surgery, be the reproductive surgeon. I mean, that's what we started off being in this field as well before IVF, which is relatively still new, like back in the 80s only, right? And so you were fixing Mullerian anomalies, you were doing all these other things. So like if you want to be a reproductive surgeon, there's even like the Society of Reproductive Surgeons, which is spearheaded by REI. Physicians, like that is something that you can totally do. Like find your passion and find your niche, and you can pursue that within the field.
I think they're one of the head of like an insurance company, like the medical directors in REI of one of the insurance companies. I forgot which one.
Probably.
Like, there's so many things you can do, and then I know someone else who's a dean of a medical school who's an REI.
Like dean of, like if you want to. Like that is something, yeah, you can do that. You could be the dean of medical school. You could be the chair of the OBGYN department. Like there's the REIs that are doing that. So the sky is the limit, really.
One of ours is the dean of admissions. Dr. Obertag's going to run a hospital one day for sure. I'm just waiting to see that happen.
There's someone posted a question, I can't find it, but it was about advocacy, because are all our REI physicians involved in patient advocacy in terms of like advocacy for insurance purposes, helping patients get insurance coverage. Do you know of any medical student or resident opportunities if you're not an REI fellow or REI physician or anything along those lines?
So, I would encourage everyone also to participate in ACOG. as well, because that's a huge leg of advocacy, especially for like residents and medical students to get involved with at that level. There's OBGYN PAC, Political Action Committee, that you can involve in. ACOG has a congressional leadership conference every year where you go to Capitol Hill and you lobby for women's health rights and advocacy. So you kind of learn about that, as well as like you go to a conference, you learn about how to be a political advocacy. At Hopkins, we also have opportunities to do like graduate work in political advocacy. There was a resident who like she did OBGYN, but she also did a whole like political advocacy type of fellowship in women's health. So there's those opportunities available as well. But I would definitely encourage people to get involved at the local level, and then especially with ACOG as they're our big, I guess, umbrella organization over all of OBGYN, and see how that goes.
Yeah. On off of that, like just, I mean, even if you don't have an REI program or a big REI presence with advocacy, like if there's an OBGYN program, there's probably someone doing advocacy in there, and you can find your niche in that area to kind of get your feet wet with people who are doing some sort of women's health advocacy, and you can kind of find your way to go into the endocrinology and reproductive aspect of it. So I think that's something, a good way to segue in, even if you don't know who the specific REI advocacy is. But I'm gonna head out. We have no nurse first call, so I'm the first call as the first year fellow, so I had to answer some pages. But it was very nice to talk to you all.
Either I was talking about private practice, but we didn't.
Fellowship. I hope you enjoy the rest.
Yeah, good luck, Dr. Anderson. You're gonna do great.
Everyone, bye.
Bye.
It's us.
Just us. That's for last. Just kidding. No, but I did just see a question that is a very common question. What's the best way to find a connection in the field of REI early on if there's no shadowing opportunities around you, like due to COVID or whatever, or connections that your med school can offer? And I definitely think that even if you are in the middle of nowhere, there is a fertility clinic in your state. Find them, call them, email them, talk to that doctor. If you're in medical school, you say, I'm a medical student. Hey, my name is so-and-so. Can I come shadow you? Can I come sit in on virtual consults with you and just be someone that they can't see? Can I learn from you? Just get the experience, get the exposure. You add it to your resume. They write you a letter. You ask them if you can do research with them. Go to ASRM, get a publication. You can find people. You just have to start using this part of your body that you probably didn't have to use much of, which is like networking. So just put yourself out there, talk to everyone, connect with them. Like look up online, like look who is in Oregon that is an REI doctor or wherever you are, and you can do it. You can all do it. I did it. I mean, it was so hard. We've all done it. Like, from not having not being the smartest kid in the grade to not being not being like the best personality. Like you can all do it. Like you have to network though.
Yeah, and I think like it's just so much easier that people are more comfortable doing things virtually now. So this is the time, the opportunity to reach out to people, even if it's across the country.
Yeah, definitely.
Someone just posted on the chat, is there any minimum number of publications for a successful application?
Yeah, I responded to that too. I said, and Kamaria, you tell me what you think. I know you went to like Johns Hopkins, you probably have a ton, but I had like a lot of poster presentations, a lot of like, that's easy. Anyone can get a poster presentation. If you're a med student, anything you submit will get accepted typically, but always submit 5. So hopefully you'll get 1. And so I had like all these posters and like actual publications, to be honest, I had 1 or 2. Okay. Most kids coming in now to fellowship applications, they have like, I've seen some that have like 40. And guess what? Their last name is the same last name as the first author and the last author.
Right. Oh, you same person. Listen, we're talking about the same person.
It's quality over quantity.
Right, over quantity, right?
So,
like
for some people say it's quantity over quality.
Not true.
Not the stats what I think, but like in terms of like applying. some people have told me.
I mean, I will say this, like, I know I mentioned earlier, like following through is very important, but sometimes like if like you just did this abstract as a resident and you didn't have time to write the paper yet, and that's okay. Like, you know, you don't have, everything doesn't have to have necessarily been tied up and neat and tidy when you submit your fellowship application. Talk about what you're doing next. Like, oh yeah, I did this abstract and currently we are looking more at the data, or we're doing this, or my plan in the future, I want to accomplish these things. Because we all know, like, sometimes attendees get busy and then you're bugging them or nagging them, and then maybe this is just not going where you thought it was going to go, and that's okay. I think that I just want to put that out there as well. And then like I guess something that a former fellowship program director told me, who did this for like years and years and years. He's like, the minimum on application, because someone, that's what they asked, is like, should be like 3. So
that's
I thought you were gonna say like 30.
no, like 3. So it's a lot less than you think it is.
Yeah, 3. But they and you know, again, these are publications, like actual published. When you do a poster, it's published in the magazine in Fertility and Sterility, but it's not a publication. I mean, you put it under poster publications, but when it comes to like actual oral presentation, okay, so it goes, the order is poster presentations, put them on there, but they're not as important as oral presentations.
Okay.
Put them on there, but not as.
Can you dumb it down a little bit? Because like, okay. I'm sure I'm not the only one.
Okay.
So when you say like poster, if you're submitting it to a magazine, like isn't that like?
Yeah. Okay. So sorry, I didn't mean magazine. Okay. Fertility and Sterility. It's a journal that like all of REI doctors read. Okay. It's like this red and white journal. Okay. It's run by ASRM, the American Society for Reproductive Medicine. Okay. So when you submit a research project, like with a little bit of data, you write an abstract, okay, and you say, I want to submit this for poster and for oral presentation. If it's amazing, you get oral, but typically as a medical student,
so the conference, not
for the ASRM conference, yes,
not to not to like a journal as a poster.
Right.
Okay.
And then you submit it to ASRM, and then once you do the poster, you get accepted as either a poster or an oral presentation. Poster is not as good as oral. Oral is amazing, but not many people get that as a medical student. You know, not even as a resident. But either way, you put them all on there, and then you try you add that onto your resume. And you try your best to make that into a publication the poster, having been a poster at ASRM, it actually goes into their supplement of their publication for their journal. So you can put it as a poster publication, even though it's just a poster, you know? Okay. And so same with the oral presentation, and you try to make that into an actual publication. Now, actual publications, meaning an article that has like a conclusion and a beginning and all that stuff, like an article, those are the best. And I think 2 to 3, like Kamaria said, will be the best, is fine. But you don't want to put, you know, you and your dad's research that you just like snuck your name on, like every single time.
People will know, and they'll it's a huge turnoff. We're talking about the same person. That's how small our community is. Right?
Yeah. Wait, so to clarify, when you say like this 3, it's 3 to get into residency or 3 to get into fellowship?
Oh, fellowship.
Okay.
Fellowship.
Okay. Someone asked, is shadowing sufficient in medical school? So what I would say is it is good. It is very important. It is definitely sufficient. However, if you know you want to do REI, start your research as soon as possible. Medical school, you have so much more time than you do as a resident. If you can start anything now, I know it doesn't seem like it, but trust me, you'll understand.
You guys have a leg up because you're thinking about this right now, honestly.
Yeah, you do. So just do something, anything. Like I said, submit to ASRM, submit a poster. You can add that. You're already way ahead of everyone applying to residency because you went to ASRM and you did a poster. You know, now it's virtual, but it's still
ASRM. So, and that's the only one, right? Is there what other fertility conferences that's like, oh, so you submit a poster to ASRM? Is there like
So ASRM, Oncofertility, there's MRSI, Midwest Reproductive Society, or I don't know, what's the I stand for? I can't remember. There's PCRS, the Pacific Coast Reproductive Society.
Yeah,
Then
that's
there's
a really big one. Pacific Coast Reproductive
SRI. SRI is the Society of Reproductive Investigation, and so that's our more basic sciencey conference. So a lot of bench work and translational work is more presented at that type of conference, where ASRM is like very clinical, and they also do work too. I presented work at both conferences, and for my bench experience. So those typically are, there's ESHRE, which is the European Society. Like the ASRM counterpart in Europe. I mean, if you're over there presented at ESHRE, like kudos to you, because that's amazing.
Yeah.
Those are generally our main conferences that we're going to.
Yeah, definitely. I mean, for me, I only went to ASRM and PCRS, and I went to them millions of times. I mean, as a medical student, I went to my first ASRM conference when I was a third year, went to Hawaii. I thought I was the youngest person there, and no, the first one was in Orlando. Sorry. I thought I was the youngest person there. And I had a poster from doing this like summer research with like this REI clinic that I shadowed. And I was like, oh my gosh, I'm the only one that wants to do REI in the whole country. That's my age. This is great. And then all of a sudden these people come out of the woodworks, and they're like, as you're in residency, it's like all these kids your age are like, oh shoot, like I got to compete with all these people. But if you start early, you start networking early. So you like see these like important doctors, you know, walking around that are heads of programs and stuff. And so they'll notice you, and it really helps.
Yeah. And then also ACOG, I forgot about that. That's a conference.
I never even went to that.
Yeah. They have, you could do stuff there too.
Yeah.
And then someone asks, is quality improvement something that is focused on in REI? Most definitely.
Yeah.
In our fellowship, you're supposed to have a QI project anyways in order to graduate, but there are tons of things. Like one of my interests right now is looking at like genetic carrier screening counseling. Like, how are our physicians counseling our patients? Is it the appropriate things that they should be counseling? Are they saying the things that needs to be done for carrier screening? How the patients perceive that? Like, is there something that I can do to improve it, right? Like, so maybe I need to provide all our physicians in our office with a template of like what to say, or at least maybe they have a diagram to explain to the patient, this is how many chromosomes you have, or like whatever. So like it's a standard thing our physicians are saying, because it's like it's very hard in a limited time frame that you have to see a patient, especially for a new consultation, to go over those things that we throw at you, like, oh, can you sign your life away? This is kind of like a mortgage, right? No. So I think it's streamlining that. Like, so that's one thing that I'm interested in doing.
That's a great QI project.
Yeah, I also did QI for quality improvement for our Epic. So Epic is our EMR that we use. So I made a whole bunch of smart phrases and templates that our entire physician group uses. So it's streamlined and it's standardized. So tons of ways to improve.
Yeah, and if your interest and research has only been in quality improvement because, let's say, your medical school residency made you do that, which is so annoying for me. But if it is like, and that's a really big part of like what motivates you and what you love, like put that on there. That's like amazing, because we're like, yes, come do all the QI projects. Like all it does is make us better. For anyone who doesn't know what QI is, it's quality improvement projects that like hospital systems are required to have every year. And so you have to find an area of your field that you think needs improvement to increase the efficiency or the care, improve the care of the patients. And I mean, everything we do every day, we can think of some way to improve it, right? So it's like really cool to be able to like be in a project, but it's kind of annoying because you have all these other research things you have to do. But if that's like the thing that you've focused on and you really love and are passionate about, like talk about that. Like that's a publication, that can become a publication. Like don't just waste that opportunity of research. Like make that into a publication, submit that to ASRM or PCRS or one of the things. And like that can become, you know, use that. Get on one of the residents' QI projects and be like, I'll do this for you. And then become the first author and submit it for ASRM or whatever, you know, like those are the things you can get involved with.
And then someone else asked if endometriosis research would be cool. She's like, in case I don't find any REI research for endometriosis research would be cool. Listen, endometriosis is REI research. You're good. Golden.
Yeah, definitely.
No, this is
Super,
a good
super
one.
REI.
Any advice about how to network when you're an introverted person? I think social media, if I don't know, you don't need to be in person.
Yeah.
Yeah. And I think things are changing, right? We're not meeting in person anymore. Like our conferences are going all virtual.
How do you think that's going to be in terms of networking? Like,
Oh, I think actually it's probably terrible. Like I don't have high hopes for ASRM this year being virtual because it's so much fun going and seeing people that you haven't seen maybe for the year and just talking and bouncing off ideas. I don't know how they're going to implement it this year.
Yeah.
I mean, maybe like more like this. And sometimes, and like an introvert, maybe you're more comfortable like asking questions like in this type of format or just kind of, putting yourself out there, maybe so much, not in person, but like just here. And I think, the first, you have to have some initiative to take a risk, right? I think one of the main drivers of human nature is one of the risk of like scared to be a failure, and don't be scared to be a failure, because I guarantee you somebody was in your position thinking the very same thing, and someone said, hey, like let's meet up, let's do this. I think that is a very vulnerable thing to think about, but please don't let that be the holdup.
Yeah. And like, it's funny because it used to be beneficial to be an introvert, like in medicine, I feel like, because they're cerebral and they were, they just look like an introvert. But with social media and stuff now, it's like beneficial to be like this, like blonde looking, like, whatever, just like not, but to be honest, like, I think that like, I feel that if you are an introvert and like, let's say you're a very private person and you don't like to put yourself out there on social media, totally fine. There are some like really amazing social media presence, like doctors that instead of putting themselves out there, they put out like information about REI that's like just as good, if not better, than like these people that are just showing their face all the time, but as far as like networking goes, if you're an introvert, I think that like some people are better followers or silent leaders, and so you just have to be somewhat of a leader to be a doctor, but like, you can show your strengths in other ways. And if you are like a silent leader, then by boosting other people up and showing your character and showing your dedication to the field in other ways, I think that it really, it's amazing. And it's important in our field to have all different types of personalities. You don't have to be outgoing to be an REI doctor. You should like people to be a doctor that takes care of patients. But I think that, we also have a lot of research scientists that just don't like talking to people and they'd rather be in the lab. And that's really important to our field too. So, you can find your way. We need them all.
There's another question along this line that I like these questions because sometimes like students, like you just need some advice on this. I need advice with how to network to get active in research. Do I write directly to random people on social media who are in the field? This is like, I guess if someone obviously doesn't have a program is part of their institution. I want to help out and I know I have the energy and passion for it. I just don't know how to reach out. But before anyone answers this, I just want to reiterate. So we sent everyone the link for the surveys. So there's the pre-webinar survey that everyone was supposed to fill out. And after you completed it, if you looked at the confirmation page, it says, thank you for completing. Here's a link to the post-webinar survey, like on that same window browser. And then you're supposed to click the link for the post-webinar survey. I know it's a little bit confusing and I apologize. If you X'd out of that window, that's fine. Just click back onto the link. It doesn't need to be the same link. click back onto the link for the survey, and then instead of filling out where the first question asks for initials and like a number, so you can remember it to put that same initial and number in your post-webinar survey so we can match up the results. Just put mistake under the pre-webinar survey and don't fill it out again, and just press submit. And then it'll take you like, oh, thank you for submitting. And here's the link to the post-webinar survey, and then just fill that one out using those same initials and letters so that we can match them back up. Now, after I said that, going back to that question.
Wait, what was the question again?
Question, I like this question. Where was it? Hold on.
Someone answered it.
Yeah. It was like, how can you give advice of how to reach out?
Oh, wait.
Where did that question go?
Did it go to answered? Maybe.
How do people if we answered it? It just picks it up. Oh, you answered it.
What was it?
Any advice with how to network to get active in research? Do I like write to random people on social media who are in the field? I want to talk about it. I know that I have the energy and passion for it. I don't know how to reach out. Can I answer
So
for this?
So I think you should kind of think about what may interest you in the field. If you don't, and then try to find people who are doing that type of research, right? So like if your thing is, if you like really like fibroids, or for instance, if you really like endometriosis, then it's helpful to find people who are doing like-minded research. So that's number one. And then like look at what they're doing, like what research are they doing, what publications are they making out there, and then reach out to them saying, hey, Dr. So-and-so, I really am interested in your research doing X, Y, and Z. I see that this is something, like, it helps when you go and you approach that person and you know what they do. Like if somebody was like reaching out to me and was like, I'm interested in research, but they didn't like, read about any of the research that I do or anything like that. It's like not as impressive as someone saying like, oh yeah, I saw that you do this. I really want to be involved. Or is there a way I can do that? Or is there someone you could direct me to? I think that's always a good transition. Someone you can direct me to, because if they don't feel like they are interested in like picking up you as working with them, they may be able to put you in contact with lots of other people who.
Yeah, absolutely. I agree. And yeah, you just email or call whoever.
Yeah, email.
Worst that can happen. They don't pick up. They don't answer. Trust me, Kamari did it. I did it all the time. And, that's how I got my job at Shady Grove. Literally my first year fellowship, I was in Ohio and I was like, I have to get back to Atlanta. So I'm like, oh, Shady Grove started in Atlanta. Let me call the head of HR. So I the phone. I call this lady. I found her number online and she's like, yeah, I'll talk to you. And I'm like, okay, I want to go to Atlanta in 3 years. What do I need to do to get there? And she's like, wow, this is amazing. You're calling like 3 years in advance. Let me tell you what we care about. We care about ethics. We care about blah, blah, blah. She gave me these 5 things. I kept them in my phone. I've memorized them. Every time I met with a Shady Grove person, I basically repeated those words. And like, that's how I think I got the job really early in the middle of my second year. And I feel like, you just reach out to people that you want to work with. You make it happen because no one else is going to make it happen for you. It's not just going to happen. You have to network and reach out to people.
And then someone said, have a.
Hang on. Can I say one thing about the social media, asking random people? So I randomly met Dr. Harrington, who was on this webinar, and I was telling a friend who I know is interested in REI. I'm like, yeah, this guy's so cool. He was just really nice on Instagram. And she reached out to him and she saw like he posted about a research project he was doing. And she's like, hey, do you need help?
Listen, we need help.
And I was like,
yeah, we need help.
That is really cool.
So cool. I love that. And
no
also
say no to you like wanting to do data mining and like no one.
Yeah, we need help. And also know that like what Eliana did, like, helping other people that are in your same position that maybe your competitors, like, shows such strength of character. And it's huge. So don't ever think of your colleagues in your, level, even though you're both going to be trying to get into the same programs and like they are your friends for life. They are your colleagues. And the more you show that like you help others, like it, trust me, we can tell, you know, like you don't want to look like you're trying to one up people or anything like that, you know? And so, like, how, you know, help your peers.
To address the comment and I didn't mean data mining like a priori. I meant hypothesis driven. So when I mean that, I mean like we have a hypothesis, right? And we have things that we need to look at. So you look at the data within your data set. So I don't mean go out and like try to fish for something, like, you know, have a hypothesis driven research, and medical students and residents are very helpful in that, especially when you're looking at databases and you may not have all the resource or the manpower to do it because you're doing X, Y, or Z. Like that's why we have a team of people who are working on things. And I think it's very important. And I think everyone has a dedicated role, and their role is important in that research. So I
agree. Data mining does not necessarily mean that it's not hypothesis driven. You have to go through millions of electronic charts to get, you know, this data on patients that have PCOS, like their, let's say, AMH levels or something. That is mining the data. You know, it doesn't mean you don't have a hypothesis about the AMH levels in these PCOS patients being high or low or whatever. It is mining through thousands and thousands of charts that, you know, we frankly don't have time to do. And you learn a lot. We all did this as an intern and a resident. Like, you have to data mine and you learn what that AMH level really means, because you've seen it a million times in different people's charts and different BMIs. And so you realize that, you know, you just learn things, you learn trends, and the only way you're going to do it is by data mining. I think, you know, it's really helpful.
Mm-hmm. Mm-hmm. And then to whoever said that if I have a pending publication, is that's still in data collection or RIB review process, is it still better than having multiple abstracts published? I think, yeah, I mean, it shows that you're moving on, and you're actually trying to write your manuscript. And I think that's amazing, you know, and that's time consuming. It is time consuming. So sometimes, you know, like we said, quality over quantity for sure.
Mm-hmm. Okay, y'all, I think
it's time.
I feel like this.
Any other last questions, burning questions that we didn't answer, we didn't get to?
I mean, there's a lot of questions that I feel like we may not have answered, but if y'all feel like your question was not answered, reach out to Eliana, Camaria, or myself. We are happy to talk to you guys.
Tomorrow, I'm going to send out like a post webinar email, and it has everyone's like contact information, all the panelists. You're all so kind. I know you're all so busy, and you all, thank you so much for wanting to mentor us and to be there for us and answer all of our questions in your free time. And they all are allowing me to send out their emails to everyone, so I really appreciate it. Hopefully,
yeah, you guys will do great. If I can do it, y'all can do it, I promise.
Thank you. It was so nice to meet you, Dr. Kadenbad. I know you.
Oh yeah, very nice to meet you, Eliana.
Yeah, good choice. She's amazing. And she told me who you were. I was like, oh my God, yes, she's my favorite. I love her so much.
But do you know, really quick, because you're on here, Dr. Kadenbad, her Dr. Christina Mitchell. Didn't she go to Johns Hopkins? Aren't you at Johns Hopkins?
Yeah. So, what was your question?
Dr. Christina Mitchell? Did you?
Yeah. Yeah, so she's the same year. Well, so she just graduated. So she's a class that, I mean, technically, I feel like I'm in your class, even though I have this extra year. So Christina Mitchell was my co-fellow. So she started at the same time I did, and she just finished. But since I have extra year, I'm going through.
Okay, because I helped out on I don't know how it ended up being with her, but I helped her on a meta-analysis. That's my connection to Johns Hopkins.
Oh yeah, great. Yeah. No, yeah. So she's at a practice in Delaware now.
Oh, wow. Mm-hmm. Thank you so much for your time.
Yeah, of course.
Good job, Eliana. Amazing. You're such an amazing medical student. Like, you are someone that I'm sure all these medical students and residents, like, I mean, I want to be you. So let's just be real.
Thanks.
I don't know how you do it, but keep it up. Thank you
We'll
for
have to figure out
organizing.
how to improve it for next time.
Yeah.
Well, hopefully you'll get some good feedback on these surveys. So
Yeah. Thank
it was
you.
great.
Okay, yeah. Bye, everyone.
Bye.
Bye. Reach out with questions.
Please, please.